I just think it's rude, ignorant, thoughtless.
Your risks far outweigh the benefits.
It's up to me to weigh up the circumstances that I'm prepared to risk.
I just need to have my testicles checked. When I swing over, they sort of go glump.
Oh. You're in pain, Mum.
Oh.
Doctor, can you put your finger up my bum, see if I've got a lot of poo up there?
I mean, if I was going to go, fine. But I don't want to find I'm going to spend months almost like a vegetable.
There are some risks of people having a stroke. The worst case would be that you didn't make it through.
Yeah.
Good morning, Putney Mead, how can I help?
How can I help you? That will be Dr. Neal, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes by 8:09 we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about. So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask you a question? If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes to the doctor and he says, where'd you get that? And you said, is your husband beating you up? And the mother, turns around and says to the doctor, yes. Can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was trial and retribution.
Oh,
It's like...
So it's like this, Doctor. A man shouldn't hit a woman and a woman shouldn't hit a man. See, so...
No, we never done nothing, nothing's done nothing like that at home.
No.
The staff have been very good.
Yeah. Okay.
Anyway.
But you two are all right?
Yeah, fine.
Yeah.
And you said you was going to mention the doctor and about your bum.
Every time when I eat something, he goes right through my stomach. It gives me diarrhea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass wind in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore. Oh, it's very sore.
Okay.
You have to give it a few flushes before it really, gets rid of it.
Yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh dear.
Hello.
Good morning.
How are you?
Not good, not good.
Oh.
I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally. because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry. It's Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing.
Right, well, with regards to your cough, I'm just wondering what the next step should be. I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. Sometimes one of the medications can cause your ankles to swell,
yes,
and one of them can cause a cough, so I'm a bit reluctant to increase any unless we need to.
Yeah.
Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision.
Yeah.
Okay.
Well, thank you very much.
Good morning, Putney Mead. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye.
Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh,
yes.
what a big bit.
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajra, could you help me out with something to sleep, please? Because I think I'm sort of, I don't know, my brain would just won't let me sleep, you know what I mean?
Okay.
I was sort of coming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
I think I've got that. That is it.
My dad's a dentist, and he suggested maybe having metronidazole.
Okay. I think there's always a strong argument. If things are improving, to hold off. Metronidazole is not the nicest drug.
I actually wanted to see if I could get some amphetamines.
I wouldn't necessarily be happy to prescribe sort of amphetamines.
And how about steroid injections? Have you?
I want to do the hyaluronic acid or whatever it is that they're doing. That's what I want to do.
I appreciate if you can prescribe me with some diclofenac.
Okay. I'd probably just use paracetamol and ibuprofen.
I prefer not. Diclofenac is the best solution for me.
Take a seat.
Right. Yeah, the reason I come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it. Was stopped because I should have seen someone in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
But then I've also been attending this surgery more than any time in my life, probably. And I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
well, if I'm
I can
told,
reinstate it. Yeah. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we
Andrews.
managed to sort that out this afternoon.
Because I came in here absolutely. I had steam coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
Hello, Patty Mead, Lorraine speaking. How can I help?
Hi there, you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, I suppose,
And any thoughts of cutting back on your alcohol or getting a bit more help with it, or does your outreach worker help you with that?
Well, it is from a drug and alcohol organisation, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Do you think you can do it? Oh, someone's right.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right, okay. There you go.
Hi, is that Charlie? Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah, cheers, Charlie. Bye. Bye. Is it all right if I talk to Charlie about you?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right?
Okay.
And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, would you do me a favour? Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry. Well done. Good.
Good boy.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we have that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
My tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing. Okay.
Oh, thank you, doctor.
That's the blowing test. There you go.
Oh, thank you, doctor.
And do you, what soap do you use?
Well, I use a body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Yeah. Sure, I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest flowers alone.
Okay. All right then. I'll see you soon.
All right, doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you?
Yeah.
Oh, it's a very interesting job. You get to meet lots of lovely people. Oh, oh.
Warm this up, shall we?
Hello.
Oh, you're quite heavy. If you open up nice and wide for me and say ah. Say ah.
Hello, sweetie.
Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mr. Hart. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all
A few
day?
seconds.
A few seconds.
A couple of minutes.
Couple of minutes. Okay. And what are you doing normally when it comes on?
Right, can you and let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley.
Ashley, right. You've been warned so many times now.
Probably you
Right,
should.
now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry. So
I was recently diagnosed with a hiatus hernia that came up in a chest X-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm
No.
coming.
probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had a history of gallstones.
Right.
And I've also had a history of heartburn.
So, and what was it
indigestion.
If you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the patient's, the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
I'm okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there.
Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews,
Yes,
a
I
good
saw
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment, it's just that
Yeah, that's fine.
she doesn't have a penis. You do.
Okay.
I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump,
Okay.
you know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, you know, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take that.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
About a couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so. I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, you know. I think it's my nature. I can't let go things quickly. I want everything perfect in my life, you know, especially in the business, you know.
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you.
Pinch your nose. And blow. Keep blowing. Keep going. Keep going. Keep going. That's how
I had something that was similar to asthma.
I always have been suffering of coughing.
Are you bringing up any phlegm?
A what?
The muscles that line the passageways of the lungs, they tighten up.
We need to try and get the asthma under control because at the moment it's not ideal.
Oh, you are wheezy. Got a little orchestra going on in there.
How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly three years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after. Can't move, can't talk.
Okay.
He's like a cabbage sort of thing. You know, I've seen a friend passing away, so I think.
So you've experienced it close up.
Experience, yeah.
And so I think we need to make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is the biggest problem, and then another one factor is my dad living with me, and it's getting a bit. I know he's 89 years old. It's my responsibility to look after him, but it's just getting sometimes a bit irritating, you know.
Okay.
Sometimes, you know, he makes a lot of mess in the kitchen, and when I see it, I said, what is this, Dad? Come on. Things I tell him, don't do it, just leave it there. He keeps on doing it and makes a mess. And that boils me up, you know.
I'm just wondering what might help you. What techniques could we try, or could you try, to stop yourself getting to the stage where you just boil over, suddenly going from nothing? You're not going to be able to change him.
No, there's no way I can change him, you know.
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, you know, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you can really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the everything.
And then can you have a think over the next 2 weeks,
okay,
between now and when we touch base, what else might help you to manage the stresses?
Okay.
You know, just have an ideal world. What would help you? What do you need to do? What do we need to focus on?
Okay.
We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we
okay.
can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
do
It's
that.
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Hello, Putney Reed, how can I help?
Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not. And it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. All over. It makes like a bubble noise. Brr, brr. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, it might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Pushing your finger up my bum?
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breath. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat and we'll talk it all through. Let's have a look. That's in the bars. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine. Slightly enlarged, but a normal shape. And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles, they do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone, just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases,
Yeah.
really. Okay?
Yep.
All right.
Thank you very much
Not
indeed.
at all. Nice to
Thanks.
see you.
Stop me if it's sore when I'm doing this, okay?
Right.
It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at, and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what when's discussing that? Do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, well, not doing very well at all. Really, I'm getting out of breath. It's all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well, and in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart, was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was good to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know,
There are some risks of people having a stroke and things like that during this type of procedure.
yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing, I think your symptoms are steadily becoming quite a lot worse, aren't they?
I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice.
I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously it suddenly gets worse, I suppose you need...
If things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay, nothing I can do about it, is there? Yeah.
When the time comes, whether I will have intervention or not, I think it is it very much depends on the the situation. And I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible.
All right.
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
Many years ago.
right?
Yeah.
And you're fitting well otherwise.
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to this.
Oh yeah. Okay. I'm just gonna tell me to stop if it's too tender. I'm just gonna put my finger inside. That is a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes when they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
You'll be gone?
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari. Do you know it?
I don't know. Sounds nice, though.
And whilst we're there, I'm proposing. So, we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a?
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach, and then just go down on one knee as the sun's coming down, and if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories
Yep.
and some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep,
Well, I hope it settles down.
Okay,
All right.
wonderful. Okay.
Bye now.
Have a good day.
And you.
There was this
Can't be
woman
bothered.
came in and she wanted to register her unborn child. And I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
'cause
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah, yeah.
And if I press...
Oh, yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there. Oh, you see.
Let me know if I hurt you.
Ow.
You won't enjoy this too much.
Oh, sorry.
Oh, that's so
dear me, dear me. I had a constant pain in this area.
The pain goes from side to side.
Oh, blimey. I feel so ill.
It's a cyst. I won't do any more.
Pain is bad. I'm in a lot of pain.
I can see that.
Oh.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across
Because
here.
pain at the front.
See, it's difficult for me to sleep in and everything. Oh. then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh. See, it's only that I sort of pulled myself up and
it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because, unfortunately, she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some inquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some help. At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, no.
So leave it with me. Am I able to get you on the phone later, John?
Yes, you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement.
Got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye.
Bye.
People often ask, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.